Hello, care partners. Teresa Youngstrom here. It's so great to see you. Hey, I've really appreciated all the feedback and the questions I'm getting. Some great questions. And you know what happens to be a real popular topic right now is, do they have awareness? Do people that have brain change, do they have awareness? Do they know they have it or do they not know? Because it's interesting that some seem to know and some don't seem to know at all. As a matter of fact, they're indignant and mean and fists up, ready to go and fight you on the whole thing. And in my experience, that brings a lot of hassle and a lot of bouncing around to behavior units and who knows, antipsychotic drugs. So I think we need to back up. Today, I want to back up with many of you who are just getting into this and just want, this whole question of, do they really know they have dementia? And so we're gonna dive into that. We're gonna dive into, what it really is, dementia, what are signs and symptoms, what are the real diagnosis, the most popular ones. So let's get started. Let's get started on slide number one. So, dementia is really a collection of symptoms. We hear people say, oh, I got dementia, she's got dementia, he's got dementia. We throw that term around, but you and I both know that that's not really the diagnosis. We call it that when we really don't know what it is at this point in time. Or if, like my mom, we didn't get her to the doctor early enough to really get a diagnosis. And then by that point, she was too afraid and she was not going. And so that's okay. It's just that then you just do comfort care and symptom management, and it is okay. So, but let's kind of delve into what the collection of symptoms are. I would say memory loss is usually the first thing people notice, and sometimes it's the person noticing it, but sometimes it's other people noticing it. Okay, it's sometimes they're like, that didn't seem right, or that didn't make sense, or that was odd that she didn't recall this appointment. We've talked about it 14 times. So, memory loss, of course, in short term typically is what most people are suffering from early on. Well, then what else? What's another symptom? How about problems communicating or word finding? So, it could be using the wrong words. It could be I just can't find the right word. But let's be honest, at my age and above, occasionally can't find a word. And if you're married, it seems like your spouse can come up with the word you're looking for, and I can come up with his. And so that's just kind of funny in that relationship. But so not the end of the world if we can't find a word, but it can be a symptom of a bigger problem. All right, next slide. Trouble planning or organizing. So maybe this person is falling behind on their bills. Maybe they are not able to work their calendar very well. Maybe we have to go to a great big calendar, put it on the island. Maybe they are just not realizing they need to make that next appointment. How often do you see the dentist? Well, you have those appointments. How often do you see your doctor? And then the doctor might say, hey, you need to get blood work. And so can they plan and organize those things? Or can they plan and organize holiday events, family events, things like that? So we could see a variety of different things. Guys, these are people. They're individuals. They have personalities. They have cultures. They have likes and dislikes, and they're all different, just like you and me. And that's okay. But we really have to figure out what's going on with them. And the symptoms kind of fall into these popular ones that I'm giving you. So, appearing confused or disoriented, we might see that. We might see paranoia, suspicion, or hallucination. Hallucination seems to be connected with some certain things. There are certain diagnosis in brain failure that has more hallucination, Lewy body. But then there are medications that give us hallucination too. So, it's so important to discern. Are they having challenges because the medication they're on? I mean, I want to be a great detective when we're seeing symptoms. Because guess what? Sometimes these symptoms can be caused by something that's treatable. What else could that be? You know some things. We've talked about it. Yeah, UTI. Urinary tract infection, real common for making us look like maybe we have a dementia. But you and I both know that dementia doesn't come on overnight. Dementia doesn't come on when you're just in the hospital. Dementia doesn't come on like that. I mean, it might show its face a little more when we change their location or we're in a different situation, different routine, different place, different bed. But there are things to rule out that are treatable that might give us these symptoms. And so let's think about thyroid disease. Let's think about low B vitamin. Let's think about brain tumor. I hate to think about that, but let's rule out the other things before we just settle in that this is a true dementia. Another symptom might be getting lost, and that might be getting lost going to the grocery store. That might be getting lost in their own home. Okay. All of a sudden, things don't look right. Um, a lot of times we see more confusion as the evening hours come. We call it sundowning. Brains are tired, not working as well. And I've talked in the past in other podcasts about things we can do to come alongside and support those people. But getting lost could be a symptom. Poor coordination, control of your or control of your movements. So maybe your dexterity isn't great. Maybe you are shuffling. Maybe you're falling. Maybe you're having trouble just getting in and out of the car. Some things that you should be able to do routine. And now there's poor coordination. Maybe you can't use your fork or your pen or your toothbrush. Okay. Because we do lose skill fingers. Skill fingers, strength fingers. Whoops, in the camera. Skill fingers, strength fingers. Yeah, we can lose your skill fingers as this disease progresses. And so we might see them not being able to, you know, write a card or sign their name or write a check or something along those lines. Loss of logic and reasoning. This is so frustrating for the family. It was frustrating for me when my mom went through this and the logic was out the window and it was my way or the highway. And again, I didn't know if she knew about her dementia and I needed to do more research. Listen, guys, I had been a nurse 30 years when my mom threw me out of the house. And so when someone says to me, "Oh, you do dementia. Oh, okay. Yeah, I know about that. My grandma had it." And I think, I thought I knew. And so I would just recommend you have an open mind if you think you know about dementia because it was so much more involved. And we are still learning things all the time about this crazy word called dementia, this condition, this syndrome, whatever you want to call it. It's really the collection of symptoms and your person's symptoms will be different than mine. But I tell you what, I got real busy looking for resources when I watched my mom decline and back then I really couldn't find great resources, but you know who I found. Top of the list was Teepa Snow. That's right. Positive approach to care. They were awesome. And I ended up leaving a big job to go to North Carolina to study under them because they had the corner on this, and I'm forever grateful to that organization. But loss of logic and reasoning, boy, that's really tough because they're not making sense, and they're telling you this reason, and you're just like, oh, okay. And there are times, guys, when you have to go with their flow, and I need you just to say, wow, I never thought of it that way, huh? And make sure your tone and body language is okay with that. Make sure you're not going, that isn't right, and giving them, some kind of hairy eyeball about it. Just go with the flow. It's brain change and we can't fix it. So you might see personality changes, loss of safety awareness. Maybe they're thinking they can go ride the lawnmower and they haven't done that in 10 years. Or maybe they think they can go uh, drive to Florida and they live in Ohio like me. So and then there are other times where we seem to lose the filter in the brain between our thoughts. I have mind and mouth, which is true. It's between like you get a thought, someone walks by and you notice something, but you know what? That thought shouldn't always come flying out your mouth. You should be able to discern and be kind. But sometimes we lose those filters, that ability to discern between your mind and your mouth, and that can get you in trouble. And so sometimes I'm telling you, these people, they get in huge, huge trouble sometimes way before anyone recognizes they have a brain failure going on. They've gone to jail, right? Or gotten divorced or been charged with, find them in divorce court. It's terrible, but it's because we aren't really paying attention or we really are unaware of these symptoms. So I'm hoping today you'll gain some wealth of information to have in your mind and put these tools in your tool belt so you'll have them. How about unable to manage finances or purchasing items? I mentioned the checkbook before if you can't sign your name, but keeping track of your finances is a real big problem. I knew a lady once, she lived in a high rise retirement community, fancy dancy. And I was called in to see her, and her bills were stacked there. She really hadn't opened a letter in, I don't know, it was a 2 foot stack of envelopes that had not been opened. And I'm noticing a lot of them with red letters. And I'm like, uh-oh, and found out she was in collections all over the place. And this was a woman who had plenty of money, but had lost that ability to manage her finances. And we had to bring in help for that. And purchasing items. Yeah. So can they still go to the grocery and get what they need? Can they still go put gas in their car? A lot of questions, right? A lot of questions and a lot of symptoms. And your person will probably have, 3 to 5 of these before someone says, okay, we need to get this checked out. It's like one thing, they make a couple mistakes, and you and I both know this brain failure comes on over time. It doesn't come on overnight. So if someone says, "Oh, they got dementia in the hospital," I want to I want to wait, what? And let's talk about that, because that they could have some a delusional episode or something, but a true dementia means two parts of your brain are dying, right? It's something progressive and something that we can't stop. Yeah, no, that doesn't show its ugly head just because you're in the hospital for the weekend. All right, so let's just be smart about that. So back to the question. But do they know, like, each of these situations, each of these symptoms, do they really know that they have a dementia? Well, some seem to know, yet others don't. Some seem to know, but others don't. Well, dementia is not really a diagnosis. Maybe it has to do with what the diagnosis is. So let's kind of investigate what the diagnoses are, um, because dementia is a collection of symptoms. But let's look for the diagnosis. Let's look a little further. And there's lots of different testing we can do. I mean, you've got the 30-question test, or you can draw the clocks and do the things. I think those are very preliminary, and we should get on to geriatrician or a neurologist or someone who, functional doctor who's doing this kind of testing, someone who specializes in brain change, and can do some more sophisticated testing. But we can also do, I mean, sometimes blood work, spinal tap, sometimes we're doing scans, MRIs, PET scans, things like that. And they're developing new tests all the time. Well, let's research that. So what are the common diagnoses, you know, that go along with those symptoms? I'm going to pull on the Mayo Clinic today and read you what they say about some of these diagnoses. So Alzheimer's, it is the most common, right? And I think we all are well aware of that. But according to Mayo Clinic, not all cases of Alzheimer's disease are known. Experts do know that a small percentage are related to changes in 3 genes. So that's a possibility. But they also say that the theory is that it has to do with your plaques and tangles. And that's your, clumps of protein, the beta amyloid. And then the tangles, the fibrous masses in there, the tau proteins, and that those, they're thought to create these clumps and damage healthy brain cells. And so that's Alzheimer's. It does not come on quickly. It's a slow, progressive decline, starts off mentally, and then eventually will become physical. And if they live long enough, and that's kind of the way Alzheimer's disease works. Then we have vascular dementia. We'll go to the next slide. Vascular dementia, according to Mayo Clinic, type of dementia caused by damage to the vessels that supply blood to the brain. Blood vessel problems can cause stroke or affect the brain in other ways, such as damaging fibers in the white matter in the brain. So, most common symptoms, it says, according to Mayo Clinic, with vascular dementia would be problem solving, slowed thinking, loss of focus, and organization. And these tend to be more noticeable than just the loss of memory in these folks. And I've seen people with vascular, it's almost like a stair step. It's like they might have a brain accident, they might have a TIA, they might have a mini stroke, And then they recover from it, and then they trek along a little bit longer, and then it could be a year, and then they change. They have another brain accident or another part of the brain that gets affected or is compromised. It might be a stroke. It might be huge. It might be half their body becomes paralyzed. But usually, it's a stair step of decline where Alzheimer's seems to be just slow. Decline, slow progressive. I think vascular moves more like a stair step according to how many brain accidents they have and how long they live. Well, they can live a long time if we stabilize things and stabilize their blood pressure. Um, it all depends on what their comorbidities are, guys. And comorbidities, for those of you not in the medical area, comorbidities means what are the other symptoms or what are the other diseases they're dealing with? Are they diabetic? Do they have a cancer somewhere? Have they been treated for a cancer somewhere? Do they have respiratory issues, heart issues? What are their issues? And so that can a lot of times determine prognosis or how long these people might live with the dementia. It's not always the dementia that takes your life, okay? A lot of times it's something else. So Lewy body is probably the next most popular, and it's becoming more popular all the time. We're learning more and more about Lewy body, but Mayo Clinic says Lewy bodies are balloon-like clumps of protein, and they've been found in the brain in people with they're calling Lewy body dementia. Dr. Lewy, right? We all realize that. Alzheimer's disease and Parkinson's disease, they have found Lewy in these other patients because you can have what's called mixed picture. We'll talk about that. But common symptoms include acting out in dreams and sleep. So they might be physically active in their dreams. They might see things that aren't there. They might see the children there. They might see the puppies over there, and they're not really there. So they're common to have these visual hallucinations. Symptoms include problems with focus and attention. Others include uncoordinated, slow movement, maybe tremors and stiffness, known as like a Parkinsonism. And so Lewy body gets confused with Parkinson's a lot because it can have changes in our walking, or in our hand motions and the tremors and all. In my experience, working a lot with Parkinson's community fitness and just studying, it seems like the people that have Lewy body, if they have tremors, they tend to have tremors with purpose, meaning when they go to reach for the cup of coffee, and that's when the hand gets all messed up and they tend to spill things all over. But the people who have tremor, say with Parkinson's, they tend to have a resting tremor. It might be their head, it might be their hands, it might be other parts of their body. But that's just been something that I've been able to find that can help differentiate between Lewy body and um, and Parkinson's. But the thing about Lewy body, it does move faster, unfortunately. And I have found that sometimes with Lewy body, these folks can be on and um, acting with purpose and knowledge and logic, and then they can be off and they can be hallucinating and somewhere else and erratic. And it's really tough. I just want to tell you, those of you dealing with Lewy body, that is a tough one. Frontotemporal, you might have heard about frontotemporal. Well, here's what Mayo Clinic says about frontotemporal. It's a group of diseases characterized by the breakdown of nerve cells and their connections in the front and temporal lobes of the brain. Front temporal. These areas are associated with personality, behavior, language. Common symptoms affect behavior, personality, thinking, judgment, language, and movement. So before, when I told you about being able to discern between your mind and your mouth and what you should say or not say, okay, that's usually in the frontotemporal. That is a common thing that we see when the filters fall out or safety awareness is no longer there. You believe you can drive the car and you can drive it to Florida. And I did have a gentleman get in a car and drive about 150 miles before he ran out of gas, thankfully. And the officers were so great and they were so well trained. And we got him help, and it was really a happy ending. I know you can't believe that there could be a happy ending, but this family would come back and tell you then that last year of his life was one of his best. He did find a girlfriend in the memory care, and they were just like peas and carrots, and he couldn't be happier, she couldn't be happier, and they held hands every day. And um had no awareness of their previous life or relationships, and they were living in the moment. And yeah, so I just want to tell you, I want to give you hope, and help with dementia. It's on my logo. It's what I'm about. And I just want you to know that don't just go, "Oh, no." I want you to let's join this person and figure out how we can give them the best life, how we can join them on their journey, and it's gonna be an individual, personalized journey. You can see they have different diagnosis here. So let's go to the next slide. A mixed dementia is so a lot of times when they do an autopsy on someone who has passed away with a dementia, they might find maybe they find Lewy body, maybe they find different areas of the brain that were affected by other diseases. And so it's not uncommon at all to have a mixed picture. And then Parkinson's, of course, lots of people with Parkinson's, up to close to half, do develop a dementia. And I work with a lot of those individuals. Parkinson's starts off as a physical problem, right? The inability to move their limbs smoothly, and but then again, it's use it or lose it, guys. Make sure that you get in a gym. Make sure if you can find a gym like Parkinson's Community Fitness in Cincinnati, they specialize with Parkinson's folks. Their trainers are all well trained and they understand how to work with these individuals. And it's a nonprofit, and so anybody gets to go. Um, but it's move it or lose it with some of those conditions. And so I'm hoping that you will get great care, great encouragement, and keep moving your body. All right. So it's just some other, I mean, there are more than 120 diagnoses that can give us symptoms. Can't, no time to go through all of those, but it could be an alcohol brain syndrome. It could be a low B vitamin. It could be a traumatic brain injury, and on and on and on and on. Lots of different things can give us this. So, but do they know? So with each one of those diagnoses, does everybody with Alzheimer's know? No. So does everybody with vascular know? And I want to say no. Some will and some won't, guys. Unfortunately, some will and some won't, as this disease continues. And honestly, there are some from the get-go will be argumentative and um, in denial that they're having any of these problems. They're liable to blame you for those problems. There are some people that definitely see it. Some, they kind of fall into these two categories, and some are aware that they have this and they're frequently, sad, depressed, and needy, and they'll accept your help. As a matter of fact, they won't want you to leave them from helping. They want you to help. Honey, I just can't. I don't. And so they will accept help, which is, we're thankful for that, which makes the other group of people a little more difficult to care for, because these are the folks that are unaware. Okay. They appear paranoid, suspicious, never wrong, and always the victim. That was my mother. Do you know anybody like this? Huh? You're always wrong and they're always right. Well, we got to figure it out because it's brain failure. They're not acting like this. They're not putting on, they're not being difficult. They're not having a behavior. I mean, what behavior are they having? They're using their brain the way it is right now. They didn't ask for it and they can't change it. So all we can do is come alongside and serve these people, right? We call it anosognosia. Anosognosia is the inability to see your deficit. I wish I'd have known about this. I'd been a nurse a long time and actually was kind of irritated that I had never learned about anosognosia like in nursing school. Because we see it with bipolar folks. Why do folks with bipolar, they get on their medicine, they start doing great, and then all of a sudden they have a moment of, ta-da, I'm healed. I don't need my medicine anymore. I'm healed. And you're going, uh-oh, maybe, but don't go off your medicine. Because when they go off their medicine, then it's a roller coaster of challenges and good and bad days, and abilities to go out and work or have purpose. It's tough. And so um, they need an accountability partner to help make sure they continue to take their medicine. We see it with schizophrenia, but I learned that we see it from Teepa, that we see it with probably half of our folks that are dealing with a dementia. And sometimes in the morning when my mom's brain was less tired, she might be able to track with me a little bit better. And she might say something like, "Oh, don't remember that." And she might have a moment of clarity. But I can tell you as the disease progressed, she slid over into the category of unaware and stayed there and didn't come back. And most people will. And it's not just a sundowning thing, it is their way of life. And trust me, you will need a new care plan to take care of this person. You'll need a new care plan. They can become absolutely indignant, dig a heel in, and by golly, you want to fight, you're going to get one. Well, that isn't what we're supposed to do. That isn't, I mean, that I wouldn't say that's good care. And I've had caregivers say to me when I'm trying to enlighten them on this disease and this part of the disease that the reason you're fighting with her is because she doesn't have awareness. You need another care plan. You need to help them feel like they're the smartest one in the room. Because guess what? They think they are. They think they're the smartest one in the room, and the rest y'all a bunch of idiots. Honestly, they might not say it like that, and maybe their personality isn't as strong as my mother's, but that ultimately is what's going on, and you need to figure out how to play that part. Just like if she were aware and you would play the part of just being her best helpmate and you would, serve her in any way she needed. Now they're unaware. So, okay, we got to switch gears, but it's not impossible to serve these people. But you need to help them feel like they're the smartest one in the room and you need to give them purpose. People need purpose. People in general need purpose, right? I mean, why be here if you don't have purpose? And so to give them, ask them to help you with tasks and do things, ideal, ideal. My mom was in a wheelchair, but she could cut coupons. And I'm telling you what, I didn't even use coupons that well. I'm terrible about coupons. But back in the day when we got lots of coupons in the paper, I would take them out there to her house and, "Oh, mom, if you could help me with this because I just don't have time to get these coupons." And my goodness, she would love doing that. She would have stacks of coupons. She'd have them all paper clipped together and would be beaming with joy when I'd get there to pick up those coupons. And then the next week I'd bring her more. And so that was a season. That was an activity that we did with her to give her purpose. These folks need purpose. We really are not supposed to just park you in front of the television, right, and bide our time. I really think you can engage them in so many better ways, even if they don't have logic anymore, which with the anosognosia, we typically, the logic is gone and it's my way or the highway. So, but can they still enjoy a bird feeder? Can they still enjoy a puppy or a kitten? Can they still enjoy music and singing and dancing and so many other things that bring us joy in life? I think they can. And so that's the direction I want you to go. These folks that don't have awareness, you can't fix it. Don't go in there reminding them that they have brain failure, reminding them, finger wagging them down that they are wrong about something. Okay. That's not what we do. And so you just need to have a care plan where we ask them to help us. What does that mean? Well, I use this example all the time, but guys, it's my example. My mother was in a wheelchair. She would not let you help take her to the bathroom. Caregivers would call and say she's not going to let us take her to the bathroom. She needs to go to the bathroom. Trust me, she's leaking on the kitchen floor. And so I came in one day and I just made conversation, pleasant conversation. We visited. I, of course, approached from the front like we all do. Don't touch until you have permission. Notify your face you're happy to be there. Watch your tone and body language. Don't come in and fill them with all the problems of the world. Bring them a moment of joy. And how about a smile and a compliment? All good techniques, all good tools to have in your tool belt. So I would come in that way and visit for a little bit. And then I'd say, aren't these shoes cute? And she'd usually say yes or something. And I said, oh, but I got a blister. And I said, it's killing me. You know what, Mama? I really need a Band-Aid. And I think they're in your bathroom, but I can't find them. You are such a good finder. Could you help me find these? I really need your help. And for me to need her help, she sat up a little bit taller, like, that's right. You do need my help. And I'm telling you what, 95% of the time that worked. And I used that exact reasoning and example with her to go to the bathroom for 3 years. Yep, I did. And it worked. And on the way back to the bathroom, I'm talking about puppies or kittens or the grandchildren. We're just having conversation. I'm telling her a story. I'm telling her a happy story. And you find good stories that she likes, reuse those stories. We don't have to invent the wheel every day. Make a list of what works. Make a list of her happy places and what she loves to talk about and look at. Make a list of that. It's all good. And then, we had our routine in the bathroom and it worked quite well. And so I just want to let you know that we shouldn't fight with these individuals that can't see their disease. The fact is, some will, some won't. And your job is to come in with the ability to assess if they have awareness right now. Do they have awareness? And that doesn't mean you come up and go, do you know who you are? Do you know your name? Do you know your birthday? Do you know where you live? Okay. Nope. That's wrong. Wrong. That's a big F. That's wrong. I want you to just be able to approach from the front with a smile. You greet them in a friendly way and have conversation. Be sure and sit in front of them if you expect them to understand or listen to what you're saying, because they may or may not have awareness to what's to the sides of them. They lose peripheral vision, so they may not have awareness. And if the TV's on, well, that might have their attention. They're not listening to a word you're saying. And then you might get angry at them because they're not paying attention. Like, okay, back up. All wrong technique. Come in, visit, give them a compliment. Okay. And then, hey, I really need your help in here. I can't find that Band-Aid. I really need your help out here. I mean, I sort of remember how to make these pancakes, but you're the best. You're the best baker here and you're good at it. So I was hoping that I could try and make your pancakes today. Something like that. Guys, you can do it. It'll take a different care plan, but we need to do something to allow them to feel like they're in control. Do they know they have dementia? That was the question, the $1,000,000 question. All right, sometimes. So your job is to be a great detective and not a judge. You need to come in and assess for their awareness or lack of awareness, okay? Um, and then join them on the journey. That's what we do, guys. We join them on the journey. Will it be easy? Nope. Will it be worth it? Every day, every minute of every day. It's worth it. Every minute. I don't regret a day of any minute that I took care of my mom. Okay, guys, please like, share, and subscribe. Hey, we miss you when you're not here. So please like, share, subscribe. And there's someone you know that needs this information. And we just keep putting out more and more great information for you. I'm Teresa Youngstrom. My company is A Better Approach to Memory Care. You can find that at teresayoungstrom.com, and we have resources for you there. But as far as this podcast, we really want to get it out to everybody. Memory Care with Teresa Youngstrom. Find us on YouTube and Spotify. All right. Thanks so much to Griffo Productions for being the best broadcaster out there. All right, everybody, keep in mind, you got this.